Hi everyone, welcome back. So I'm here today to talk about how massage can help those of you who have been through domestic abuse. I will also be doing a follow-up video on the benefits of massage with post-traumatic stress disorder. So the two are sort of quite closely linked. For me, this is very much both a personal and professional discussion. I know only too well the effects that domestic abuse can have on every part of your life, in a physical sense, mentally, socially, everything. I have consequently dealt with PTSD for quite a few years, and just recently in the last year have really become able to understand just how effective massage can be in overcoming some of the issues related to this. I was very fortunate to have had a work colleague who was incredibly understanding, incredibly patient, and I was able to overcome one of my biggest triggers, which I will talk a little more about in the PTSD video. So I'm going to start by talking about some of the statistics around domestic abuse, which really are quite staggering. About 85% of domestic abuse victims are women, 15% men, which obviously we don't often hear about. There's enough women that find it very difficult to come forward. For men, I think with the social stigma attached, we hear even less about these cases. But yeah, 1 in every 4 women experience domestic abuse at some point in their life. And approximately every 24 seconds, someone is abused by their partner. And of all of these people, that's a really high incidence, yet only about 25% of physical assaults and about 20% of rape and about 50% of stalkings are actually reported to the police. And, it's very easy for people to say, oh, why didn't you tell someone? Why didn't you leave? Why didn't you report it? But until you've been in that situation, you really just cannot understand just how difficult it is and how much, when someone manipulates and controls you for so long, how that really does change how you respond to things and how you who you trust, and so I think therefore for therapists dealing with clients who've gone through this, I understand it is very difficult, if you've not been through it yourself, to really understand the effects and to know how to deal with it. But it's so important, and less than 20% of domestic violence victims actually seek medical attention, which basically means that, sometimes they've got old physical injuries or certainly mental and emotional scars that will continue to affect them for years. So that's partly where massage can come in and really help deal with those physical and emotional issues. So, but the first thing I'm going to talk about with regards to domestic abuse is basically shock, and that sort of response to the initial trauma. You know, when we suffer any kind of abuse or trauma, we basically we're forced to disconnect from our bodies in a sense, and we freeze or we panic because our nervous system is just completely unable to cope with the physical, emotional, or mental trauma. And the extent of this vulnerability that we suffer is then held in our body's cells, and it just kind of sits there burrowing away, and most of the time we don't even notice until possibly years later, when something will just trigger it, and all that pain that we've kind of buried will emerge, whether it be physical symptoms or mental or emotional symptoms. Some of these symptoms will be things like chronic fatigue, chronic joint and muscle pain, certainly it will bring about a persistent weakened immune response, which opens us up. It makes us vulnerable to infection. We're going to get a lot more run down more easily. We are also going to be more prone to developing autoimmune diseases. They have actually been related to shock. Just through the sort of stress levels, we're going to suffer insomnia, and there can be other physical issues such as either sort of muscle rigidity or hypotonicity, so low muscle tone. And with the weakened immune response as well, that's obviously going to really sort of reduce our resistance to healing, meaning that any injuries, either from the trauma or that we go on to develop in the future, maybe we won't recover as well as we could do. So what this shock does is basically it takes away our neurological capacity to act. Usually when you face a stressful situation, we've talked before about the fight or flight response, to do with the release of all your stress hormones, but I will go on to talk in the PTSD video about just how this is altered at the time of the trauma in someone who develops PTSD. But yeah, if we are suffering from that shock response, we don't have that same neurological capacity to act and to deal with another stressful situation when it happens. And this can sort of lead on to things like causing us to behave in a destructive manner, creating obsessive patterns, or participating in addictive behaviours, which usually reduce our energy levels further. We can participate in kind of dysfunctional sexual patterns. Consequently, a lot of the time, we can, either due to this or just due to the emotional scars that we carry, we will go through failed relationships. So it can affect us socially as well. And, even in extreme circumstances, it can cause people to, demonstrate either criminal or violent behaviour themselves. And all of this is just a response to the shock and the trauma, which depending on which part of the nervous system takes over and becomes dominant, you can end up in a sort of permanent or long-term state of hyperarousal. Consequently, this is where people sort of will look at someone who's been through abuse or is suffering PTSD, and they'll think, well, you've really overreacted to that situation. And actually, it's not really an overreaction. It's just a natural response, to what they're going through. But people don't understand that because they don't understand, being in that situation. So shock is basically demonstrated by an immediate, sort of almost chaotic response to whatever the threat may be. But after that initial trauma, even if we've had long-term therapy, the shock can still be there. We're still experiencing those symptoms of shock, and it will reveal itself through somatic issues, which will often remain unresolved, because no one actually relates it to, that trauma that you had maybe, 10, 20 years ago. And so the reversal of these dominant responses in the nervous system is really essential in resolving the shock and allowing you to move forward and, deal with any future shock or trauma with a healthy response that is not going to, damage you any further. So by eliminating this shock, we can then enjoy not only, good physical movement, but also productive relationships and freedom to express ourselves, openly. And where massage comes in is that, an intervention like massage therapy, just even with minimal touch, if it's combined with, a safe environment and someone who is respectful of what has happened to you, that intervention can really help calm the nervous system and stop these sort of this hypersensitivity, when dealing with future, stressful situations. By calming the nervous system, massage will just really start to allow transformation right down to a cellular level. But also, it brings that person just extra resources, even just positive human contact, something that may have been previously unavailable if they, have a lack of support. Certainly something that, was probably unavailable in the relationship that the abuse happened. That to actually just experience that can really be a positive thing. And I've spoken previously about how human touch, with the hormonal responses, can really lift someone's mood and really open someone up to trusting people again, which of course will help us in our, in our social life and forming relationships. So, how does massage help survivors of domestic abuse and trauma? Well, basically, for a start, the massage therapist can act really as a confidant, A relaxed client will often start talking about, personal things that maybe they might not want to talk to anyone else about. Sometimes it's, easier to talk to someone who is, sort of not involved in the situation or with that person in any way. And so, in a safe and private environment where the client knows that everything's going to be confidential, if they're relaxed, they often feel able to open up a bit more easily. I think the other sort of factor is that obviously when someone comes for a massage, they're taking their clothes off. So any bruising or cuts, that would otherwise be covered with clothing, are suddenly going to be exposed. And this potentially could bring about a conversation with the therapist, just by sort of asking, oh, how did you get that bruise? The client may or may not start to open up. So yeah, in that way, it can really just sort of help the client to sort of start to sort of realize those emotions that they've kind of been burying down deep. So massage, it can be kind of a passive form of asking for help, of showing someone that they trust the bruises, and this is where the therapist really needs to be, have a good understanding of how to deal with it, when to give information, when to ask questions, or simply wait for the client to open up, which, they more than likely will. If it's at the point where you as a therapist have seen, physical bruises, the client is more likely to open up, about the emotional bruises that they've suffered. Massage can really basically act as a sort of a time of refuge, and a time of healing, of overcoming the shock that we've talked about, with someone that's not directly involved, but someone that the client knows that they can trust, and where anything that they say will be confidential. And that's a really hugely beneficial thing for anyone that's gone through this. Massage can even be used as part of a recovery program, by reducing stress and anxiety and encouraging relaxation, both on a physical and mental level. This will also allow that client to just start to reconnect, with their body in a positive way and a healthy way, and to be able to rebuild trust, as I say, in a safe environment, with a compassionate and skilled therapist. This will then, allow that person to function normally, rather than sort of dissociating from what's going on around them. We often use dissociation as a defense mechanism, a way of coping with the stress and a way to protect ourselves from fully experiencing the abuse, or even fully remembering the abuse when when those sort of triggers come up in our life. As we've said, human touch, the benefits of human touch in terms of the release of those feel-good endorphins, helping to lift your mood, helping you to, deal with stressful events, better. But just the power of that touch, knowing that, being able to experience human touch in a positive way instead of an abusive way, experiencing touch in a way that is respectful, that in itself can help bring out hidden trauma. And, the therapist may be able to see physical signs of that, whether it's changes in skin tone or muscle tension or something in the person's voice, or gestures. You pick up on these little things. And, even after, victims of domestic abuse have escaped, even years later, you still experience those physical scars. You still have emotional scars. And that comes from just repeatedly having been made to feel like you're not good enough, like you're not worth anything. And these scars will impact on your health, but just through observing, on those sort of little physical signs, you as a therapist, you can kind of pick up on, the emotional side of things too. So massage can be obviously particularly rejuvenating for someone who's gone through abuse, allowing, the client to heal not only on the outside, but also on the inside and on all that emotional sort of baggage that they're carrying around. And it allows them to just, put those struggles to one side, even if it's just for an hour, and just to see that they do have some value and they're not, they're not this worthless thing that people have sort of tried to make them believe. And when they start to recognise their value, they will then start to kind of move forward and start to just be able to form normal relationships a bit more easily. The body does remember trauma, unfortunately, and but massage can, really help kind of push out that, stored trauma and all the tension that comes along with it. We've talked about how many victims of trauma kind of disconnect from their bodies. But massage can really kind of just ground people and just create that feeling of safety. And I think also, even if the therapist doesn't have an actual conversation about the abuse, just being able to help a client in this way can in itself be a form of feeling believed. And I think one of the hardest things for anyone who's gone through domestic abuse is that maybe because people don't understand the situation and they don't understand how someone could ever allow someone to manipulate everything so much, they don't believe that person. And when you finally come across someone who believes you and who respects what you have gone through, that in itself is it can completely transform you and transform how you deal with what has happened to you, but also how you deal with, with stressful incidents in the future. And just that belief and respect in itself can be, a more potent intervention than the treatment itself. So I think this is where the therapist's intention comes in. And I will be doing a future video about the therapist's empathy and setting intentions for your massage treatments. If the therapist, can incorporate this belief of that person into their treatment, that will really benefit the client. So massage can really help that person just become aware of themselves in their own body again. It can honour that person for themselves, for who they are, without them being objectified or judged or put down. It will also re-educate the nervous system and the immune system, which will allow us to heal, and just allow the client to just feel safe in their own skin. It's one thing to have counselling and talking therapies, which are great for, the emotional scars that we've talked about. But unfortunately, they don't address the physical scars. Massage, through its effect on the nervous system in particular, it can address both the physical and the emotional scars. There are some things as a therapist that you should be aware of if you have a client that you either know or that you suspect has been through domestic abuse. The first thing is to just really be observant. Yes, if you see unexplained bruising, for example, you can certainly ask the client, but then you really have to judge according to their response, and really pick up on non-verbal cues as well, and just not kind of push for an explanation. You want to listen to your client, as I say, both verbal and non-verbal communication, and just be aware that, you can ask questions, but, sometimes a client may not feel comfortable in answering them, and that's okay. If a client sort of admits to having chronic fatigue or joint or muscle pain, they're probably going to be more than happy to explain that. But it's just sort of having an awareness, of potential things, that could be causing, these physical issues. Another thing to be aware of is that, and this kind of goes on to the PTSD issue a little bit, just to be aware again with, when we're talking about human touch, that, for the client may have previously been a very negative experience. It's important to be aware that during a massage, a client may have flashbacks of past abuse. So, you need to be, as a therapist, you need to be supportive, you need to be empathetic and compassionate, quite often people who have gone through abuse may not be able to adequately express what they're feeling or to communicate their needs. They may have problems defining boundaries. So again, it's down to you as a therapist to, ensure that there are boundaries in place. Things with regards to boundaries, so things like draping will obviously be particularly important, again, to make that client feel safe as well. Where you place your hands, and even just, your stance, where you're standing, the position of your body during a massage treatment. These things could potentially trigger a flashback. So if you either suspect or if you know for sure that a client has been abused, it's probably best to avoid deep tissue techniques and certainly sports, because they could be perceived as unsafe, and therefore encourage flashbacks in the client. It's easy for us as therapists to forget that shock and trauma is stored in the body. The important thing to understand as a therapist is that if at any point there's any kind of resistance to what you're doing, whether it's physically or emotionally, just don't push it. Always kind of check with your client. If they are noticeably upset or agitated, you just check whether they're happy for you to continue with the treatment. So that's really everything in relation to domestic abuse and massage. As I say, I will also be doing a video on how massage can help those who suffer with post-traumatic stress disorder. Now, this will certainly relate to those of you going through domestic abuse. And it will also be relevant to maybe military people who have suffered PTSD or anyone who's gone through any other kind of trauma, that they're struggling to deal with. So yeah, have a look at that one when it comes out. As always, any questions, you can link in with me on my Facebook or Instagram. But for now, that's all. So I will see you next time. Bye.